Hello everyone, this is Dr. Swapnil Chandratra here. In my last video, I talked about how to prepare for the Schriftliche or a theory exam. In today's exam, I am going to talk about the second part, which is a Viva part or a Mündlich. This video I have divided into the three parts. The first part, I'll tell you about the structure of this exam, that how it is being conducted, what kind of questions can be asked. In the second part, I will tell you how to prepare for the exam, and in the third part, I will tell you that how I prepared for the exam. The most common question that should you leave the job and sit at home to prepare the exam, or you can side by side keep on working and then prepare for the exam. All those answers you will get in this video. If you haven't subscribed to the channel, please subscribe to it, because such information you are not going to find anywhere. As I said in last video, that when you clear your Schriftliche Teil, your first part of the exam, within 4 to 6 weeks time you get the result. And when you pass this exam, you are automatically enrolled into the Mündlich or a Viva part. Then you get the invitation for this exam. And generally, most of the time, you get 2 to 3 months of time to prepare for this exam. During this time, you can prepare for it. So go for a Mündlich Prüfung, this Viva part. In all of the states, the structure remains the same. There will be 3 examiners sitting in front of you, all belong to the different faculties. For example, one endodontist, one orthodontist, one surgeon, or something like that. And those examiners are in front of you and you sit in front of them. This exam is conducted for a 1 hour time. During that 1 hour time, they ask you question in 2 rounds. For example, first examiner asks you for 10 minutes, then second asks you for another 10, third asks for another 10. And then they started from again 1, 2, 3. Generally, it is been asked in for 1 hour. Generally, it is that time. Sometimes it gets prolonged, these exams. Sometimes it gets shortened. For example, in my case, it was 45 minutes. The student in front of me had 1 hour, 10 minutes. Depends on the examiner and your answering capacity and capability and all that thing. So these are the factors which can be changed. That depends on your luck also. But generally, the structure remains like this. Mostly in the beginning of the exam, they give you one case that same like what we have written in the theory part. They will give you the X-ray and model and photographs or something like that. And they ask you that what kind of treatment plan you will do. According to you, what is the best plan? Then you need to answer them what is possible, what is not possible, what is being passed by insurers, what is not, something like that. Another questions, mostly they come on a regular day-to-day dental treatments. It's more like a practical knowledge kind of thing. For example, composite filling, they will ask you regarding the composite materials and bonding generations and all those questions. And then, RCTs, what are the steps of RCTs and what are the diagnoses, in what case, what you will do and what you do in these complications and something like that. And for the surgical questions, the most commonly they ask regarding the extractions, that what are the complications after extraction and how do you manage if some patient is having a bleeding after extraction, how do you manage that? And all those things. Another questions are mostly regarding the medically compromised patients, that what you do and what you not do. Periodontology is one of the most frequently asked topic. There is a light linear here. Light linear means rules and regulation, how the periodontal treatment is followed here. So they will ask you that what is the that means stage 1, stage 2, stage 3. And what do you do in that, and all those things described. And there is a classification of perio classification. The question revolves around this basic. These are the most of the time basic questions. And around that, they will ask you some advanced questions also. Depend on your background also. That, for example, if you are MDS in some branches, then you need to be prepared to get more questions in that scenario. For example, in my case, I am an implantologist, so I got so many questions about implants. That thing can happen. You need to prepare those things accordingly. When you are done with this Viva part, they will ask you to wait outside. Most important thing is that, it is not possible to answer all the questions, because 1 or 2 questions or maybe more questions, it is possible that you don't be able to answer rightly or perfectly. It's not that a big deal. They are not expecting you to answer all the questions right or all the answers right. So that's not an issue. You should be able to answer 60 to 70% at least the correct answers. They will ask you to wait outside, and then they discuss it whether they want to pass you or not. After 5 minutes, they will call you. And most of the time, they'll tell you immediately the result, that whether you have passed or failed. In some states, they tell the results after some weeks or some days. But in most of the states, they give you immediately the result. This is how the exams will be conducted for the Viva part. Now let's talk about it, that how do we prepare for this exam? Well, in the first part also, I have told regarding the first step is to do the preparatory course, KP preparation course. In that, I have also told that, again, my suggestion is that you should, if you do the KP preparation course, you should do under German professors who are also very experienced professors. Under, they know that how system works and what are the questions can be asked and how the way you should answer the questions and all those things. It's better that you do those courses in with them, not with any random passed out students, because they are in foreigner like us. Whatever you do, the fluency of German language, it takes a year's time. My suggestion is that learn from the professors and get the study materials from these classes. That is your main goal. So it's like people can teach you, they can tell you that what kind of topics can come, for example, what I have told you. But the preparation part is yours. The Viva part is mostly your self-preparation part, that you need to prepare it on your own. How do you prepare on your own? First thing is that you need to read the books. It's not like that you need to study from first to fourth year of our BDS curriculum. No, it is not like that. There are particular books for the particular beat, particular section. For example, for the prosthetic part, you need to read the books, a curriculum prosthetic, that is part 1 to 3, that you need to read. For the surgical part, the book called Zahnarztliche Chirurgie Implantologie, that book you need to read. For the conservative part, the teeth prevention part, for RCT Endo, and for pediatric part, there is a very important book which is called as Einführung in Zahnheraldung. That book you need to read. The ortho knowledge, there is also a book called Einführung in Kiefer Orthopädie. Generally, the ortho questions are not that popular unless and until you have an orthodontic and one of the proofer, the examiner. Then there is a chances that you might get some questions regarding ortho. Still, they are not going to ask you so much deep in the ortho. You can read main questions, for example, the classification, kick classification and all those things, normal activator, bionator and all that. Rest is, you don't need to read the entire book. For my suggestion, you can read it, but it's not that popular that you might get so many questions regarding ortho. This is regarding ortho. There is also one book called the Memoryx, which I have told you in the FSP preparation also. Everything is in a concise manner which has been given. You can use it for the revision. Once you read all of these books, then last minute you want to do some revisions and everything in concise in a one book and everything like notes, then Memoryx is a very good book for that. There are also some topics like sterilization and all those side topics like hygiene and all that. Those are also there in a Memoryx, like radiography and all that questions can also come. Those are all the question answers are there. It's very well in Memoryx. These are the books which are recommended to read on your own. My suggestion is to read all the books. For orthopedy, the ortho part, that is optional. It's up to you how much you want to read it. I have only read overviews, not too much in detail. It is very important that you read the books. Don't rely only on the notes which you get from the classes, but read the books, because sometimes in the notes you don't get every answer. But in these books, everything is written perfectly. And in exams, if you have read perfectly and the examiner try to confuse you, then you can quote that, for example, I have read from this book, it has been considered good. So if you tell that I have read from some notes or something like that, it is not been accepted. Advisable to read from that. You can also read the latest articles from all of the things. The most important is regarding perio questions. That is for the light linear you need to read, because periodontal classification and recent treatment protocols which is being passed by the insurance system, that you need to read very deeply and very perfectly. You need to cram it. For that, you read the light linear for the periodontology, the recent one, which will keep on updating every 2 to 3 years or 5 years time. You can read all of these articles also. That will give you a good idea about the recent things, except the book. If you don't have the recent book, then it's good that you can read from this light linear, and with that you can have recent knowledge. These are the books you need to read for the exam. Now the part is that how I prepared for the exam. The question why it is important, that there is different views of everyone. Some people say that you have to leave the job and sit at home and prepare for the exam, and some say that you need to work. What is my opinion? My opinion is that you should keep on working. I also worked full time. I never took big leaves to prepare for the exam. In my case, I got 3 months time to prepare for this Viva part. How I did it is that my clinic starts at 8 a.m. I leave at 7:30. I used to wake up every day at 5 a.m. I used to read in the morning session 1.5 hour to 2 hours time every day. Clinic, I also used to take the books with me whenever the in between the time comes, and if I get the time to read, I always kept on reading it, because you need to utilize every minute of your time. when you come back from your clinic after full day's work, you will not have the energy to study and you cannot concentrate properly. So I will not advise you to do that. Just wake up early and prepare for the exam. I used to do that, and generally here in a year time you get 25 to 30 leaves, which is a paid leaves you get, and Saturday Sundays are anyway there, but these are the extra leaves you can get. So save those leaves during your KP time. You can utilize that leaves. For example, I took 2 weeks leave before my Viva exam. During that 2 weeks time, I used to study 4 to 5 hours a day. That was enough for me to pass the exam. Generally, you don't need to stop working. You just need to be smart and dedicated. Your concentration should be all on your exam. You can enjoy later on also, but you try to clear these exams, every exams in a first attempt. That way a lot of time will be saved. That is my tip for you to prepare for the exam. Everyone can have their own method to prepare, but this is the way I did it, and yeah, it works. Yeah, this is all about the Viva part. Again, as I said, the Viva part is more about your personal preparation. You need to cram up some classifications and some topics, and sometimes some of the things are practical based. If you are working there in the clinic, then you know that how to manage all the complication, how do the doctors do that, how do you do that. That's you can put yourself in, and in that you can answer better. This is all about today's video. In next video, the third part, I will talk about the practical part. If you like this content, please do like and share and subscribe to the channel and share to more and more of the people. Till then, have a nice day.